Hi, hello, and welcome back to you all on my new series on diabetes education. I am Dr. Vinayak Hiremat, Chief Medical Officer, Consultant at Department of Diabetes Endocrinology, KMK Hospital, Cochin, Kerala. So today we'll be talking about types of diabetes. We'll see what are the types of diabetes, and also we'll discuss about who are the people going to develop this diabetes. That means the risk of developing the diabetes, and also talk about pre-diabetes. So to talk about types of diabetes, there are basically three types of diabetes. One is type 1 diabetes, type 2 diabetes, and gestational diabetes. These are the three most important types which we see. However, to be precise, there are some other types of diabetes like MODY, LADA, pancreatic, type 3, neonatal, etc. etc. But fewer cases, so that doesn't make much of difference how we are going to deal with them. So let's deal one by one the three types of diabetes. That is type 1. Approximately 10% of people who have diabetes have type 1, or we call it as insulin dependent diabetes. The most severe form of diabetes, it occurs when body's immune system mistakenly identifies its own insulin producing islet cells as the foreign cells and attacks them. Once all these islet cells are destroyed, the person can no longer make insulin and must take daily injections of insulin or use an insulin pump to replace this hormone. So who can get this, or what are the risk factors of developing type 1 diabetes? Guys, type 1 diabetes usually develops in children and teenagers and is called as juvenile diabetes. However, it can occur at any age. If teenagers or adult, we are seeing a lot of cases such now, we call it as LADA or MODY. It is estimated that 1 out of every 500 children has this form of diabetes, but only half of the family history is positive. But having a positive family history increases the risk of developing type 1 diabetes. Because of this, scientists are looking at the ways to prevent this diabetes from occurring in those who are at the high risk. Next is type 2 diabetes. Approximately 90% of those with diabetes have type 2 diabetes. This is a lifestyle disorder or a non-insulin dependent diabetes. Unlike insulin dependent diabetes, people with non-insulin dependent diabetes, that is type 2, will produce the insulin, but their body is not able to use the insulin. That is what we call it as insulin resistance. Risk factors who can develop this type 2 diabetes, especially the type 2 diabetes, as I told you earlier, it is a lifestyle disorder. So anyone at the age more than 35 was the previous definition, but now we say anyone can develop it, although it can occur in the younger people as well as especially if they are very overweight or have a sedentary lifestyle. Commonly it is referred as an adult onset. 80% of those with the form of this diabetes are overweight and have a family history of type 2 diabetes. Certain ethnic groups have a higher risk of developing this form of diabetes. We call it as African Americans, American Indians, and Asians. These are the ethnic groups which have the tendency to develop this type 2 diabetes. Apart from this, women who have the diabetes during the pregnancy are also at the greater risk of developing type 2 diabetes later in life. Having a parent, brother, or a sister with type 2 diabetes, or being physically less active less than 3 times a week, have binge eating, high carb, night shift workers, stress, and other diseases like especially COVID, thyroid, and some medication can increase the risk of person developing type 2 diabetes. The third one is the gestational diabetes. That is, this diabetes occurs during the pregnancy, is called gestational diabetes. It is common form of diabetes that develop towards the end of second trimester, like 5th or 6th month of pregnancy, and in up to 4% of all women who are pregnant. So this type of diabetes usually results from an elevated level of certain hormones in the body which produced during the pregnancy. During the later stages of pregnancy, what happens is the placenta produces hormones which requires increased insulin production from the mother. But if the mother's body is not able to meet this demand, the need for insulin, the blood sugar rises. And this condition, if left untreated, the high blood sugar level can lead to enlarged babies, that is more than 4 kg, or sometimes premature birth and delivery requiring a cesarean section to avoid to harm the baby. And sometimes this uncontrolled blood sugar may cause an hypoglycemia to even babies or hyperglycemic effects, and in the newborn especially. So most women are usually routinely checked for this gestational diabetes by their obstetricians between 24th or 28th week of pregnancy. Although this type of diabetes usually goes off after the baby is delivered, these women have, but remember, these have the higher risk of developing type 2 diabetes during their lifetime. So recommend to check every 6 months at least for the development of diabetes. What are the risk factors? Which are those women who are going to develop the gestational diabetes? These include women who are overweight, women who are more than age of 35, women with a previous history of gestational diabetes, or previously had a baby of more than 4 kg, or family history of diabetes, or patients who have this toxemia condition which causes elevated blood pressure, swelling during the pregnancy, or the women who have previously had a stillborn baby. So this increases the risk of developing gestational diabetes. The very new term which I am going to talk about is pre-diabetes, because during this post-pandemic we see a lot of patients developing this pre-diabetes. What is this pre-diabetes? Pre-diabetes is when the amount of glucose in your blood is above normal, yet not high enough to be called as a diabetes. We diagnose it by the test called HbA1c. HbA1c range of 5.7 to 6.4%, we call it as pre-diabetes. This is the class of people who can work hard, change their lifestyle, add exercise, lose weight, and prevent developing into diabetes. So guys, stay tuned for the next video. We'll discuss some more about the diabetes, like symptoms of diabetes, how we diagnose diabetes, how we treat diabetes, and what complications it can cause. Meanwhile, I am requesting you again, if you guys have any questions about diabetes, do drop me in my inbox or the comment section. We'll try to answer all of them. As I said you earlier, we have many myths about the diabetes. Many have already pinged me about so many myths which are surrounding in the community. I plan to have a separate video on that at the end of this series. So let's not forget, the lack of awareness, education is the reason today we have the highest number of diabetes cases in the world. I hope to do my part of responsibility to try to bring down the numbers and also be a part of diabetes journey to make it smooth and comfortable. That's it for this. Thank you guys. Take care.